Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Type 1 and Type 2 Diabetes Mellitus. So here let's look at the Type 1 and starting with the etiology. So etiology in Type 1, it is going to be autoimmune. So let's write Type 1. So it is autoimmune. Etiology being autoimmune. Next is what is the age of onset. So looking at age, it is going to be usually young children. So the age is in terms of young children. And the HLA association. What about the HLA association? The HLA association will be DR3, DR4. So the HLA association is going to be DR3 as well as the DR4. Next, what about the body weight? The body weight will be normal or it will be underweight. The weight will be low. HLA association was DR3 and DR4. Now, what about the family history? Under family history, it may or may not be positive. So, they may be positive or it may or may not be positive. And the presentation is going to be abrupt. So, presentation, it is going to be abrupt. So insulin requirement is going to be absolute. So insulin requirement is going to be absolute. Then when you look at the serum insulin level, so the serum insulin level or the C-peptide level. So serum insulin level or the C-peptide level. So this is going to be low in terms of the type 1 diabetes mellitus. Now, let's look at the CF, that is nothing but the clinical features. In type 1 diabetes mellitus, there is diabetic ketoacidosis. This is common and it is associated with other autoimmune diseases such as the thyroid disorders. So it is associated with autoimmune diseases such as the thyroid disorders. That is, there is Addison's disease, there is rheumatoid arthritis, and there is Schmidt syndrome, as well as the polyglandular failure syndrome. So there is polyglandular failure syndrome. Next, let's focus on the type 2 diabetes mellitus. So under the type 2, there is the etiology being, it is insulin resistance. There is insulin resistance, and which later leads to the impaired insulin secretion. So there is impaired insulin secretion. Next comes to the age of onset. So under the age of onset, it is seen in terms of the adult, and the HLA association, it is going to be the no HLA association. So there is no HLA is associated. Now let's look at the BW, that is the body weight. So here body weight is going to be obese. Then what about the FH, the family history? Family history is going to be strongly positive. Then presentation is going to be gradual. So type 2, there is no HLA association, it is obese body weight and is usually strongly positive. Okay, the family history is strongly positive, and presentation, it can be gradual. It is gradual or symptomatic. There's positive symptoms. Whereas in type 1, presentation was abrupt. Now let's look at insulin requirement. So in terms of the insulin requirement, the type 1 means it's absolute, and type 2 is going to be oral hypoglycemics. So it is oral hypoglycemia. Glycemics, and later it is insulin. Then we move on to the serum insulin level and the C-peptide level. So let's look at the serum insulin level as well as the C-peptide. So this level was low in terms of the type 1 diabetes mellitus, whereas here it is going to be high. Then let's look at the CF, that is the clinical features of the type 2. So type 1 there was diabetic ketoacidosis, here it is non-ketotic hyperosmolarity coma. So this is non-ketotic hyperosmolar, that is hyperosmolar coma. So this is, it is common. To learn and grow daily like this, please do subscribe.